So I thought I'd do a video on my breast cancer and my symptoms and all the things about my breast cancer since so many people are asking in my family, and I'm going to post it because it's easier than texting everybody. So I'm 37. I was diagnosed early December with invasive ductal carcinoma. You can have different types and hormones and all of that stuff. Mine is HER2 positive. I'm not positive for any of the other two hormones, which just means that it's pretty aggressive. HER2 tends to be more aggressive and fast growing, which is grade 3, not to be confused with stage. Grade 3 just tells you how aggressive and fast growing it is. Grade 1 is the lowest, and grade 3 is the fastest and most aggressive. Now everybody keeps asking, what stage are you? What stage are you? And from what I understand, I don't think the stage matters as much as maybe some of the other things. Stage will just tell you how far throughout the body it has spread. And obviously the higher the stage, the more it has spread through your body. I'm not a doctor, so I don't know anything about any of that. I just know that regardless of your stage, what matters the most is how your body responds to the chemo treatment. So I don't know how right or wrong I am about that, but that's what I'm choosing to believe. So I won't really know my stage until they do full body scans, but I did just get my breast MRI done, and it's localized to my left breast in the spot that they biopsied, and it has not spread to my other breast, and I believe not to my other lymph nodes. So for now, my doctor is saying stage 2A. So for my symptoms, this is a really long story, so I'm just going to go over my symptoms. Initially, my first symptoms were nipple discharge out of my left breast, not my right. Fatigue. This is like no other fatigue I felt before. I live with a chronic illness or multiple chronic illnesses, so fatigue is no stranger to me. But this was definitely more intense, and I can go into that in more detail in another video. I was also getting breast stabbing pain, so it was just felt like somebody was stabbing me over and over in my breast, and sometimes feeling like in my nipple. Weight loss. This is also a long story, but I realized at some point, I think it was in late October, that I weighed 108 pounds. And this is actually the symptom that sent me to the doctor, because I'm normally 120 pounds, 118 at the very least. So when that symptom hit, that's when I had a red flag that something wasn't right. Once I went to my PCP and we identified that there was a mass in my breast, and I can tell you more in detail why I didn't notice that there was a mass in my breast in another video. But we did notice one. It was hard, large, and it didn't float around in my breast like maybe a swollen lymph node or a duct or something, whatever you might feel in your breast. It was definitely hard, and it was fixed to the breast tissue. Once I started putting all these symptoms together, that it could possibly be breast cancer, I started paying attention more to other things. I did notice, and I don't know if this is associated, but I noticed a change in my nipple color. So my left side was darker, whereas the other side was like a normal color. So it just reminded me of like when I was pregnant and breastfeeding my kids, where it's darker. One side was darker and the other one was not. And so that was one of the things that I noticed. I did notice that this nipple would slightly invert, and I kept telling myself, like, maybe that's just how mine are. But I would notice I would get a tingling feeling, and then I would look down and my nipple would be half like inverted. I did get puckering and tethering. If you don't know what that is, you can look it up. But basically, when you lift your arm, you have like sunken in spots, and the tethering, like when you push on the mass, it can like wrinkle your skin and all sorts of stuff. And one fun, my husband thinks I'm crazy, but our dog has been acting weird for probably, I would say, like 3 months. She's normally very clingy and follows me around everywhere, but she doesn't usually let me hold her or anything like that. In the last 3 months, if I would sit down, instead of just like following me there, she would come up to me and start like pawing me and crying and whining. and I would be like, oh, you need to go outside, you need food, and none of that was what she wanted. And then I'd be like, do you want to go lay down? And she'd run up the stairs. So she was constantly pawing me to go lay up in bed with her. And so I thought that was interesting because I've heard that dogs can sense stuff like that. But I can give you more details about my journey and how I figured it all out and what sent me to the doctor. But those are my symptoms. That's my breast cancer. And we're still waiting on a PET scan. And then I'll meet with my team, hopefully, and we'll start chemo probably not until after the holidays. But I'm very tired. Take lots of naps every day. 1 minute I'm okay, and the next I'm not. So I think it's really important to pay attention to your breasts. It's not something that I really paid attention to, because breast cancer is like only 4% of women diagnosed with breast cancer are under the age of 40. So not necessarily thinking it could happen to me, but also with some of my past experiences, I don't know, it's just crazy, and I just think it's important to pay attention and advocate for yourself, especially when you're young, because this tends to be dismissed amongst young people, especially, because it is not common. So when in doubt, just go to your doctor, and yeah, so that's all I have to say for now.